great to see so many of you here this afternoon. We have a wonderful D102 opportunity. Dr. Emily Landon, you see her next to me on the screen. You probably have seen her on TV. We are incredibly fortunate that we have this expert here today to help educate us on the COVID-19 vaccines and to answer additional questions. So I'll let her introduce herself a little bit. She's got some slides, and I think there'll be some time for some questions as well. But this is what she does. She answers questions, she educates people. And again, we are incredibly fortunate to have her with us today on a Zoom. So Dr. Landon, thank you so much for being here. And with that, I will turn it over to you.
Thank you so much. And thanks for inviting me. I'm really happy to be here. Another thing in my job description, I get vaccinated. So I got my first dose of the COVID vaccine on December 30th. You can see my reaction to that. I had them record it and I put it up on Twitter, and I was surprised to see how excited I was. It's a big deal. It's a very emotional moment to get your vaccine when you've been working on this and nothing but this for many, many months now. And I get my second dose on Saturday, and I'm really excited to do that. It's the earliest dose time I could get it. So I have some personal experience. I have a lot of experience to share from all of the other people that I know that have been vaccinated. But first, I wanted to go through some of the nitty-gritty about the science, because it's a little tricky and it's hard to understand why this vaccine came out so fast. And there was the most fastest vaccine before this one was 4 years in the making. And so how can we be here today? And are we really sure this is going to be okay for me to put into my arm or into the arm, to recommend to families that they get it and that sort of thing. And eventually someday our kids as well. So I'm going to share my screen right now. And I'm not a big fan of using PowerPoint on Zoom because I think it's a little bit complicated to do, but I think it'll work. So I prefer to just kind of feel like we're all talking to each other. But I want to address this issue, first of all, about why this is so fast. I'm going to go through a few background things, and then we're just going to let you ask questions, because I want to make sure that I answer everything that's on your mind. And you should not hesitate to ask me, even about random, weird things that you're like 98% aren't sure are not true, but are a weird myth that you might have heard, that it's good for me to know about them. It's good for me to answer them. So just keep, start getting your questions together. So the first thing we should talk about is a little history of vaccines. First vaccine in the world was for smallpox. And Edward Jenner identified that women who worked as milkmaids, who milked cows, didn't get smallpox. They did, however, get cowpox from milking the cows, and that caused a rash on their arms, because that's what was closest to the udder. And if they had a rash on their arms, then they were seemed to be immune to the smallpox that was coming around. And he got this great idea. Well, maybe we should just give more people cowpox. And what's the best way to do that? I mean, we're not going to make people milk cows all the time. People living in cities and whatnot. So he just took a scraping from whatever was in the cowpox pustules on these women's arms and put it on the arms of other people that had not had smallpox before. And the name of the virus for cowpox is vaccinia. And it turns out this worked, which is why we now call it vaccination, because it's all after cowpox. And that is the first example of a vaccine, and that is a live attenuated vaccine. That is a vaccine that is basically a live virus that actually causes infection, replicates inside your cells, but it doesn't do as much harm as the real disease. Other examples of vaccines like this include measles, mumps, those sorts of things. These are really great. They work really well, but they obviously have some downside in that in people that are really immunocompromised, they can cause actual disease. And the earliest polio vaccines actually did sort of spread, and you could see them you could spread the vaccine from person to person, which was a little iffy. And so they came up with this idea to do these more inactivated or conjugate vaccines. And then there's this section that I'm calling vaccine 2.0, which includes a lot of things like subunit vaccines and some other rare types of vaccines, but mostly they're inactivated vaccines where they actually inactivate the virus or bacteria, or take pieces of the virus or bacteria and then inject them along with something to make your immune system notice them more. And these all, vaccine 1.0 and 2.0, they all require growing a pathogen like a virus or a bacteria in culture. And viruses have to be grown in cell cultures. It's easy to get them contaminated. You have to purify them. You have to then modify them somehow. And that is what takes all the time. You have to establish a way to routinely grow these things. And then you have to, for the research, then you have to figure out how to inactivate them or attenuate them. Then you have to like sort of create a manufacturing process from scratch. The newest vaccines that we have, the ones that we're seeing today, these messenger RNA vaccines, are actually what I'm calling vaccine 3.0. They are molecular vaccines. They take basically a recipe for the protein that's on the outside of the cell that you want to target, which is in this case the spike protein, and I'll show you a picture of that in just a second. And they just give your body the recipe, and they let your body cells make that protein themselves. Then your whole body does all of the work. And all they have to do is use the same setup that they always use. They just put in a different recipe for a different thing. And while this may seem really new and really creepy because it has to do with your cells and using them to do things like translate RNA, which I'll get to in a second, is a little bit scary at first, but the reality is it's been used in some cancer treatments, it's used in some other things, and it hasn't caused long-term problems in people. So how does it actually work? Well, they create this messenger RNA because they know messenger RNA is like a recipe for a protein. And everything that our body reacts to are proteins on the outside of this viral cell. And so, which is sort of a stretch to call it a cell. Those of you biology people out there who know everything that I'm talking about, please forgive me for simplifying, but I think it's important that we get to the basics of this. So this messenger RNA is like a recipe for your body to make spike protein. And they just put in the order of the A's, C's, G's, and U's that make up a spike protein. And then they are able to spit out a bunch of messenger RNA. You put that messenger RNA into a body, and our cells don't really care if it's a messenger RNA coming from the nucleus of our own cell that's that's bringing information from our own DNA, or if it's just messenger RNA from, say, a syringe. And so the ribosomes in our cell, that's this little bump right here on this endoplasmic reticulum. Don't get too worked up about the biology. If this gives you some sort of flashbacks, it's okay. You don't really need to remember this part. Point is, these ribosomes take this and they read it like a script. It's like a little recipe, and it says, okay, I put an A, I put a U, I put a C, I put a G, I put a C, I put a C, I put a G, I put a U, and all of a sudden out comes the other end of it, a protein that is a spike protein. And it does what all spike proteins do. It migrates to the membrane of the cell. And right there where it's on the membrane of the cell, you now have your normal human cell showing just one little spike protein, or a bunch of little spike proteins that are just like the outside of a COVID virus. And what those spike proteins are not normal. Our human bodies don't usually make them. And this messenger RNA can't go backwards into the DNA of your cells. So the new cells that this cell makes can't have new spike proteins on them. You can't get it intercalated into your DNA. You can't, it doesn't work backwards that way. Our bodies have like protection against that. So these little spike proteins there are like an advertisement for the immune system. They're basically like a wanted poster for COVID. They say, immune system, this is what COVID looks like. This is what you're looking for. If you see this, please kill it. And your body goes ahead and makes all the antibodies it needs to, all of the T cell and helper T cells and sort of T cell immunity proteins that it needs to in order to fight off this virus. And that creates what we call memory in our body. And then we begin to become immune to COVID. Now, if it doesn't see COVID anytime in the near future, it may forget this protein. I mean, the reality is these messenger RNAs are so breakable and they're very fragile. And so they actually degrade within 45 minutes of getting the shot. So they're not going to stick around and cause problems, a year or two down the road. They're not even going to stick around for by the time you get home after your vaccine. And so there really isn't a lot of them. And so this is just getting your body started. What we really want is then to, after you primed the immune system and said, okay, now I showed you the picture of the spike protein. Now I want you to remember this. It's much better if we ask you to remember that like a few weeks later as opposed to a few years later. And so what we do is we give you a second dose of the vaccine, and that is basically like a training run for your immune system. It is saying, remember that spike protein? I'm testing you now. And the reality is that that triggers our body to make a real immune response, a good one this time, and one that's going to last longer, hopefully, and be more durable. And from the studies, I'll talk a little bit about what corners were cut in these trials, but it is important to note that we just don't know how long they're going to last, but certainly it's much more durable if we get a second dose. You can see what happens here as the immune response sort of starts to wane even after your first dose. So that second dose is really important, but that second dose is also what causes people to be a little worried about this vaccine, and they shouldn't be. Because if you go for a run because you're training for a marathon and you do that 13-mile run, you're gonna be sore afterwards. You know that, your muscles know it, everybody knows it. Like, you don't expect that you're gonna do your first long run and not be sore afterwards. And the same thing's true of your immune system. So what happens is when you get this second dose, or if you've already had COVID, the first dose can sometimes do this. And some people have just such great immune systems, even the first dose can do it. You're gonna be sore in your arm because of the immune response. And your body's going to be doing a trial run. It's going to be practicing fighting off COVID, even though there's so little. I mean, it's not even COVID. It's just one protein from the outside of COVID, and it goes away in 45 minutes. It's enough to make your immune system say, stand up and take notice and start doing the things that it would do if you actually got COVID. And that's what you want it to do. But that creates feeling tired, having a headache, and not feeling great. The good news is they only last for about 24 hours, not that long. I'll show you the timeline in a minute, but those are worth it because they are much, much better than actually having COVID. And to be honest with you, only about half the people have these symptoms after the second dose, but that second dose really matters. So you shouldn't be afraid of it, because it's not like that is a bad reaction to the vaccine. So how do we know that it's not just a bad reaction to the vaccine? Well, we try these in clinical trials, and it's important for everybody to kind of understand what the clinical trial process looks like. So in the beginning, we just do laboratory studies, then we test the safety of the medication in small groups, then we see if we can actually make people make antibodies, and then we do this large phase 3 trial. And that is what the data is that we're looking at now that goes to the FDA. The FDA gets to make a decision, and we set the highest bar in the entire world for our medications here in the United States, including vaccines. And that bar is all about two things: safety and efficacy. Those are the only two things. I mean, it's not very complicated, but it does take a lot of time, a lot of money, a lot of effort, and a lot of data in order to prove those things. All they need to know is that the drug is both safe and effective. So how do they know that this is safe and this is effective? So let's talk about safety in vaccines. A lot of people are worried about long-term effects of these kinds of vaccines, but it's really important to note that in all of the vaccine trials and all of the vaccines that have ever been given, and there's this whole system online called VAERS that you have to report any adverse effect that may be associated with the vaccine in any patient that you've given a vaccine to. It's been around forever. No one has bad effects related to the vaccine more than about 6 weeks after the vaccine. Now, some people have problems that start within those 6 weeks. Very rarely you can have a problem that starts within those 6 weeks and then can go on for a very long time. We're not talking about autism here. That actually has nothing to do with vaccines. You got to trust me on this one. If you don't, it's a completely different talk. But the point is that these things like Guillain-Barré syndrome or some of these weird other neurologic things that we do sometimes see after vaccine, they all start early. They just may go on a lot longer. So they decided to make the trials 2 months in length in order to determine if people had a bad effect in that time. So 2 months after the second dose, no one had any bad effects. There were none reported in any of the trials for either of the messenger RNA vaccines. Now, certainly some people did die or have a heart attack. There were thousands and thousands, tens of thousands of people in each. Some people had a heart attack. Some people had a stroke. The reality is that more people actually had those bad outcomes in the placebo group than in the vaccine group. Now, no one thinks the vaccine protects you against heart attacks, but the truth is that these vaccines aren't associated with any increased risk of any bad thing happening. The people that had bad things happen, they were just coincidence. And that's why we do trials where some people get the vaccine and some people just get saline injections. And you don't know which one you are. So how do we know if it works? Well, we try and see whether or not people get COVID. And that's the main important outcome. Now, here's where an important corner was cut. Most of these clinical trials for these vaccines would go on for a year or more because they'd want to prove that the immunity from the vaccine and the protection from mumps or measles goes on for years. But in this situation, we're in the middle of a massive pandemic. We don't need to go years. We need to know that it works now and that it works well enough to stop this in its tracks. And so here's a good place where we can cut a corner. If it works for 2 months, good. We'll start giving it to people and we'll figure out how long it lasts. And if we have to boost everybody again with another dose, fine. But the most important thing is that we get something that we know is going to be safe because of that 6 to 8 week window in the beginning, and that we know is going to be efficacious. And it's important to note that that safety isn't about feeling a little sick after having a vaccine. It's about making sure that you are not going to have a bad outcome that is long-term. So let's talk about whether or not they actually worked. These are what are called survival curves. In this case, it's not survival. They're really measuring whether or not people got COVID. So in this first one, which is the Pfizer BioNTech, and these are pretty science-heavy data. So if you don't follow, it's okay. I will give you the nitty-gritty here. The blue line is the patients that got placebo and the number of them that developed COVID over the trial period. This is number of days after dose 1 is how they did their graph. These are the people in the red who got the vaccine. These are the number of them who got COVID after the first dose of the vaccine. There's a big difference here. That's the 95% efficacy. The reality is that people who got the vaccine didn't get COVID, and people who got the placebo did get COVID. Look at all those boxes. That every one of this is a case of COVID. Over here in the Moderna, same thing, right? So those people, although these little lines are not cases, they are just, I don't know why they're there. But you can see the same thing. The placebo arm kept getting COVID cases. This is a cumulative COVID instance. They did days since randomization because they probably gave the shots like roundabout here because you get whatever, it doesn't matter. And then the people who got the vaccine didn't get COVID. This big difference is the amount of protection that you can expect if you complete the vaccine series. And this is still in all these people were having this in the time of like wearing masks, keeping distance, using ventilation, all these other things. These layers really work. And that's why everybody was worried there wouldn't be enough cases in the placebo arms because we were doing all of these other things to prevent COVID. But the reality is that there's still so much COVID going around. And with the new UK variant and the South African variant being 50% more transmissible than the virus that was in this study, we need something more than the masks and the distance and the ventilation to help us at this point. We're seeing an increase in cases, and we're basically in full mitigation right now in Illinois. So there's a good reason why we would want to have this vaccine would really help add a big, thick layer of protection. And the more people that get it, the thicker that layer becomes. So let's backtrack a second to talk about the difference between side effects, serious adverse effects, and bad reactions. I've already covered the serious adverse events. I don't think there's any concern for them at all in this study. And I think the fact that there's no preservatives in this vaccine at all, it's really literally just messenger RNA and some carrier lipid molecules, which is like fat. There's literally nothing else in it. Polyethylene glycol, which is in Miralax or in your colonoscopy prep and in a lot of skin products that you use. So you don't need to worry about that. Then there is side effects and there's bad reactions. Now, a lot of people, when their arm is sore after their flu shot, or if they feel tired after their flu shot, or if they're not feeling great after their flu shot, they think, oh my God, the shot must be bad for me. There must be something bad in this shot that's making me sick. I don't think I want all of those chemicals that are making me sick. I'd rather just get the flu. I hear this a lot from my patients and from people out in the world. The reality is that there's nothing bad in the shot that's making you feel ill. It's not a byproduct or an additive or a preservative or something toxic about the shot and the way that it works. It's not a bad reaction, aside from a few allergic reactions, which I'm happy to address if you have questions about that, which are just your body going a little bit nuts about something it doesn't need to worry about. Other than that, those side effects are actually what you want your immune system to be doing. They are literally side effects. It means we want your immune system to be all revved up to get rid of COVID. And in some people, we're going to rev it up enough that they're going to feel that reaction. And that's just part of getting a good vaccine. I don't think there's any way to make them go away. And to me, they're really reassuring. So after my first dose, my arm was sore. It was not sore enough. I felt like it needed to be more sore. I was disappointed that it wasn't sore enough, but I get that most people are probably not in that category. Now, most people did have a sore arm after their first vaccine. People we know that have had COVID before, even a while ago, sometimes felt a little sicker. They were tired. Some of them had a low-grade fever. Some had muscle aches, and some even had swelling of lymph nodes in their armpits, which all went away before they came back in 21 days or less. 17 is the minimum you can go for Pfizer, which is what we have at University of Chicago. Those people came back and they got their second dose. And a lot of people have gotten their second dose. Now, I'm not seeing patients all the time nearly as much as I used to be because I'm doing stuff like this. So I was in a later wave. So I get my second dose of the vaccine on Saturday. And I'm really looking forward to it. I know I'm probably going to feel yucky afterwards, but that's okay. I'm just going to count on it. The other thing was we're recommending people take ibuprofen. People can continue to work. Most people are able to continue to work. They take ibuprofen or Tylenol around the clock, and they do just fine. And they feel not great for some hours. Sounds like I've got a timeline in here somewhere, but it's sort of like people are starting to complain of muscle aches and not feeling great somewhere between like 3 and 12, 20 hours after the vaccine. It's that 12 to 24 hour period where after the dose, where people really start, if you're going to feel sick, you're going to start feeling sick around in between 12 to 24 hours. So you want to get your Tylenol in before that. And then it's usually gone by 36 to 48 hours. So you're looking at maximum 1 day of feeling bad. A lot of people are calling it basically a vaccine hangover, and they feel yucky when they wake up the next morning. But by the time it's nighttime, they're back to feeling pretty good and normal, and the next day is okay. And I don't have very many hangovers now because I'm old and not that much fun, but I certainly had plenty of time in my youth where I had a few hangovers, and I feel like this is worth it. So there are a lot of side effects. Up to 80% of people have what's called a systemic adverse event. That sounds really dangerous, but what it really means is they felt achy or tired or had a low-grade fever. The vast majority of those, when you look at the actual data, are pretty low grade. Now, they didn't feel great. People did complain about this stuff compared to placebo, but you can see even 36% of the people in the placebo arm felt like they weren't feeling good after their second dose, and all they got was salt water in the arm. So at least about 20, 30, maybe 40% of these are people who are having a little bit of a placebo effect, which is absolutely real. So that tells me the attitude that you go in with is the one that's going to carry the day and make things a lot better for you. So why is it that we have to bother with this vaccine when we're still doing all these things like wearing masks, keeping distance? And why is it that we can't just get COVID and get over it? A lot of people have been talking about this. Like, you may not know a lot of people who are in this Scott Atlas, let's go for herd immunity. But I want to talk about why vaccine-induced immunity is a lot better and safer. So imagine all the people in a room, like a big ballroom, like at a hotel, like a wedding or something. Everybody in there falls into one of three categories. They're either susceptible to the disease, COVID, they're either infectious with the disease because they have COVID right then, or they're immune to the disease. Now, if most of the people are susceptible still, because we have not, certainly most of us are not immune, at most maybe 10% in the highest prevalence areas, right? So if most people are still susceptible to it, if there's one or two people who are infectious, that can be enough to really attack a lot of the people who are susceptible. Even if we use masks, distance, and ventilation, it's never going to, none of those are perfect. They are really important, and we have to layer them on top of each other in order to get things to be as effective as we can. But they're also hard to do. You can't eat with a mask on. Ventilation isn't really set up that way. There's a lot, it sort of gets in the way of our regular lives. And so some people are going to end up infectious. But if most of the people walking around in that room are susceptible, many, many more of them can become infectious. Now, if you locked everybody in this room and called it its own community for an extended period of time, eventually everybody would become immune to COVID. But everybody would have to have an infectious period in order to get there. And that infectious period would infect a lot more of the susceptible people. So even if you took all of the highest risk people and tried to cordon them off in the corner, it would be really hard to get to a place where nobody was getting that, no one was able to get COVID, especially since all of the people that are high risk are living in our families. They have to go out and do things. They can't just be like squirreled away into a room, especially when you consider that about 40% of Americans fall into the high risk category. We're never going to get to 80% immune without some of them getting sick. And we don't want people to have to die. So we can skip over the infectious period and go straight to immunity by getting a vaccine. That means that we avoid all the bad outcomes that come with being sick, and we avoid all of the contamination or the sort of the infectiousness that come with having so many people sick. That's why we need this vaccine, and that's why we need as many people to get it as possible. Now, you've probably heard that there is not good evidence for whether or not you can get subclinical or asymptomatic COVID even after you've gotten the vaccine. And that's true. But this is an issue of absence of evidence, not evidence of absence. So what I mean is there's no evidence that people are getting subclinical COVID. We just didn't look for it. Again, here's a corner that was cut because we needed to get these vaccines on the market. It doesn't really matter as long as you vaccinate a lot of people. Now, I don't think that people are getting subclinical COVID. Most experts don't, but we still need a little bit of time to figure that out. And so in the meantime, it's going to be really important that you continue your other layers, because also they're not perfect. Just because they performed at 95% efficacy in the trial doesn't mean they're going to work that way in real life. And older individuals, it was really only about 86 to 90% effective. And people like me, I have rheumatoid arthritis and take medicines that decrease the function of my immune system. I'm not going to respond as well to this vaccine as normal, healthy people are. And so keeping those other layers in place until the vast majority of people are in this blue box that we have contact with is really the best way to help prevent spread. So don't give up on your masks just yet, but there is good reason to feel a lot more peace of mind. The other thing is to be careful if you're spending time with people that are high risk, like your parents or other older individuals, that sort of thing, or people who are high risk for whatever reason. Just because you've gotten the vaccine, because teachers are going to get it before a lot of regular people do, if you've gotten the vaccine, that doesn't mean that they're immune. And if you can carry it, until we're certain that you can't carry it, make sure you're wearing your mask and being careful. But once both of you have your vaccine, for example, I have a mom who's 75 and super healthy, probably healthier than me, but I'd wear my mask around her until she's been vaccinated too. And then I would feel pretty confident that we were in a pretty safe territory with both of us being highly sort of immune. And that's how we can start looking at things and how things are going to change over time after we all get vaccinated. We're going to start to expand our personal circles to include more people who are immune. And we're going to start working together. And that blanket of immunity from vaccine is going to get thicker and thicker. And it's going to make masks and distance and ventilation obsolete. So that is where I am. And I'm going to stop my share. I do have a couple more slides to help sort of explain things if there are things that you'd like to know, but I think that was sort of the basic background of things. Okay, questions?
Yeah, so I think a few ways that I think would be productive to do the questions is folks can post directly in the chat, and then I've also made Dr. Landon a co-host, which should allow you to chat her directly for the purpose of if you feel like you want some anonymity.
Wow.
But I have, and hopefully there's enough of us who are co-hosts that you feel comfortable chatting one of us if you don't want to ask your question directly in the chat. But I have so I have a question.
Go ahead.
So I know for people who are pregnant, they're being encouraged to delay getting the vaccine, but I know it's okay for breastfeeding. But if you're trying to conceive, is there anything to worry about with that, or should I be talking to my obstetrician?
So first, I'm gonna actually contradict you. I'm gonna correct you there, because we are not recommending that pregnant women wait. We're recommending that they have a conversation with their doctors. It's very clear that this vaccine, so The reason that there were no pregnant women included in the trials, because there's never pregnant women included in trials, especially in the beginning, until after these things called DART studies are done. These are toxicity studies done in animals where they give the medicine to animals that are pregnant and make sure that their babies don't have any problems in animals that are like us and have similar issues. All the DART studies are very favorable. In fact, because the messenger RNA actually degrades within 45 minutes, it doesn't go very far from your arm. And it's really hard for it to get into a placenta or into a baby. The immunity will, though. And the immunity that you get from the COVID will cross through the placenta and help protect your baby when they're born. And so there's really clear understanding amongst obstetricians. They are recommending in general, and ACOG, the American College of Obstetrics and Gynecology, is recommending that pregnant women strongly consider getting vaccinated because the actual COVID is worse for them and their baby than the vaccine is. Now, obviously, that's not going to be for everyone, and it's always a risk benefit, right? If you're staying home all the time, having no contact with anyone, have no other high risk factors, maybe it's not the best idea for you to get vaccinated. But I do think that the preliminary data, which is really suggesting that people get vaccinated. We vaccinated tons of pregnant healthcare workers, and pregnant teachers should consider themselves to be in a good category for that as well. I strongly recommend it. I think you need to talk to your doctor, though, about your own personal situation and your own personal health issues and your feelings about the vaccine and all of that. But there's no evidence that it has any effect on infertility, despite the fact that that just keeps coming up everywhere. I have no idea where that came from. That's just a lie. There's no connection between this and infertility at all. And if you're trying to conceive, obviously, so one of the concerns is that fever is not great in the very early time after conception. And if you're going to have a fever after the vaccine, that could be not awesome. That can sometimes cause a miscarriage. Not well known, but definitely true. And so you may want to just delay until after you've gotten your second dose so that you don't have a fever, but getting vaccinated before you try to get pregnant would be even better and probably feel a lot better. But I don't see any reason, especially for men, should not worry about it at all. And women who are trying to conceive, we have recommended that they all get vaccinated as soon as possible because the risk of fever, if you take Tylenol, is low, and the fevers are pretty low, not the kind of fever that is likely to cause a problem with an early pregnancy. Nursing mothers definitely should get vaccinated. Absolutely. Doesn't get in breast milk, no problem. And so fertility, I got that one, and I got the pregnancy question. And mature adults with type 2 diabetes, no, you need the vaccine. Mature adults with type 2 diabetes, there should be first in line to get the vaccine. I would go there. That's a huge risk factor for a bad outcome. So you want to get that vaccine right away. A lot of type 2 diabetes and people with comorbidities that we know can cause bad outcomes in COVID were included in the trials on purpose. And they all did great, no additional side effects or bad effects, and they had great immunity. Allergies to medications. So I already told you that I have rheumatoid arthritis. My immune system is extra special and it overreacts to everything. I have horrible allergies. I'm anaphylaxed 5 times and I'm allergic to peaches, apples, and penicillin. I've anaphylaxed to my allergy shots. So I know all about anaphylaxis. And I've talked over with my expert allergist and with a number of other allergists. We went through this a million times. I know the UK is taking a very, very conservative approach and asking anybody with a serious allergy not to get vaccinated. I think that's ridiculous. There's literally nothing tying this vaccine to any known allergies with the exception of 2, polyethylene glycol and polysorbate. If you have a known allergy to polyethylene glycol or polysorbate, you shouldn't get this vaccine. You should sit tight, either one, the Moderna or the Pfizer vaccines. You should sit tight and wait for the Janssen or one of the other vaccines that's coming out a little bit later. Those of you who've had a bad reaction to another vaccine in the past, I think the best course of action is to consult your allergist. Our allergists are giving it to those patients in the allergy clinic with rescue medications and expertise right on site. Now, all of the vaccine clinics everywhere have rescue abilities for anaphylaxis. So far at University of Chicago, we've had 1 person have anaphylaxis. They did need to be admitted overnight, but they were rescued and did okay. And it wasn't predictable. They didn't have any history of reactions. The vast majority of people who are having anaphylaxis don't have a history of reactions. So you just need to be careful and know what the warning symptoms are, and be in a place, as everyone that's giving the vaccine is expected to have the ability to rescue somebody from anaphylaxis. So you should be taken care of there. If you have serious allergies, you do have to stay 30 minutes instead of 15. I didn't have any problem, and I've had a lot of bad reactions. So I was pretty happy about it. Also, it's important to note that the anaphylaxis rate, every medication has serious allergies with it. This one is so much lower than most things that you take every day. If we gave everybody in this country penicillin, even people that had never had a bad reaction to penicillin, we'd be having hundreds of anaphylaxis every day. And we're not seeing that at all. So this is, and you probably wouldn't hesitate to take penicillin, even if especially if you didn't have a known history of allergic reaction. So don't worry about that aspect of things. If you have a serious allergy to polysorbate or polyethylene glycol, then go ahead and talk to your allergist or defer for now. If you are worried because you've had a bad reaction to vaccines before, then you probably want to talk to your allergist, but we are giving those people vaccines in the allergy clinic, and we haven't had any problem yet. How do we know it's safe for breastfeeding? The molecule is very tiny. It degrades before it ever gets in breast milk. They checked breast milk, didn't find it in the breast milk. And that's all. I don't know what else to say. It's not in the breast milk. Can I still spread COVID to others because be a carrier after you've had both vaccines? We don't know. We think, I said this before, I don't think it's going to happen, but we do need to do more study. That was a corner that was cut, reasonably so, because we just needed to get a vaccine out there. And certainly a lot of people who are now getting vaccinated are being tested regularly through testing programs in healthcare and other places. We have a testing program for certain individuals, and we'll learn pretty quickly whether or not people are having asymptomatic COVID. Now, it's not like you'd be a carrier the whole time. It would be just if you had an exposure and you got a subclinical or asymptomatic case of COVID, then you'd be able to spread it for maybe 7 days or so, and then it would go away. There's good understanding that people, because of the immunity that the vaccine provides, you probably wouldn't be able to spread it nearly as well as someone who wasn't vaccinated. So I think there's a lot of reasons to be optimistic, but just keep your mask on for a little bit longer. Yeah, if you're signing up on the website for vaccine, and so teachers are in 1B, right? So you are right at healthcare workers and nursing home are in 1A. Teachers are in the essential workers of 1B, and our state is doing 65 and up for 1B. That is going to start sooner than you think. I have some inside information, which I don't think I'm allowed to share today. Just watch the news. I think it's going to be very, very soon. And so you should be able to, and some places actually in Illinois are already doing it. So if you can get signed up for 1B in these places, yes, just check other for essential worker, whatever it's got listed, just check other, and then in the box write in teacher, and you do qualify. Any adult that works in a K through 12 school. Illinois is not going to do universities. That is the latest news, although that's still iffy. I'm not sure if that's going to work out or not. Not just yet, anyway. I mean, eventually take care of universities. We do not know, I want someone is clarifying, we don't actually know 100% what will happen to pregnant women or nursing mothers. We are very, very confident about nursing mothers. I feel 100% confident about nursing mothers. I do not feel 100% confident. I feel 90%, 95% confident about pregnant women. I think that it is about a risk and a benefit, right? We know that COVID is bad for a pregnant mom. We know that there's a new variant coming, if it's not already here, that is, you need less virus to get sick from it. It goes faster. People are contagious before they're even being reached by contact tracers. It's hard to control the spread of that new variant. And this vaccine would help you there. So I think it's a risk-benefit analysis. If you are concerned about it because you have a pregnant friend or you're pregnant or you're thinking about becoming pregnant, you need to talk it over with your doctor about your specific situation. We don't know 100% what's going to happen with anybody who gets anything because, you know, like I said, some people still die of a heart attack after they've gotten the vaccine because they were going to die of a heart attack anyway. I don't want anyone to die of a heart attack. So please exercise, eat healthy, take care of your heart, get your cholesterol checked, and do all the things you can to prevent a heart attack. But I don't think it's related to the vaccine. A low risk person, Should you feel bad about getting the vaccine? No, you shouldn't. So right now, I think it's tough to know whether or not you should forego your vaccine and let someone else have a chance. The truth is that if you're in a category that comes up and it's your turn according to the rules, you should get vaccinated as quickly as possible so that we can get through that phase and get on to the next one. There certainly are people who should be vaccinated before you, who aren't going to get vaccinated based on, some reasoning, that aren't going to get vaccinated before you. And there are some people who should be vaccinated after you, who are going to get vaccinated before you. None of these rules about who should be vaccinated when and where and how are hard and fast. The most important thing when it comes to the ethics of the distribution of scarce resources is to just choose a system and stick with it. That's the fairest thing that you can do. So don't get vaccinated before it's your turn, but when it's your turn, get vaccinated so that you can get through the main reason for having turns is because we need an orderly process to get this out to people, in addition to wanting to maximize coverage, vaccine coverage. You, young person, getting a vaccine when you work in a school helps protect the other older teachers and the vulnerable people that you work with. So it's not just about you, it's about everyone around you. And there is a benefit to doing that, especially in settings where you have to work closely with other people. If someone had COVID and tested positive for antibodies, should they still get both doses of the vaccine? So the recommendation is that you wait 90 days after having COVID before you get the vaccine. This is because you're probably going to have more symptoms after you get the vaccine, but also because we know immunity lasts at least 90 days. It probably lasts a lot longer than 90 days. There's no reason. You don't have to defer your vaccine, but in the process of giving out vaccines, you don't need it as much as some other people do. And so I would say wait your 90 days. You're less likely to have a reaction. Then you'll be saving a dose for somebody else because you definitely don't need it. You're already protecting the other people around you and yourself because you already went through this wicked bad disease. But I don't think you need to, there's certainly no evidence that you need to measure antibodies. And antibodies are only part of the picture, but that's the part we can measure. So it's the one everybody talks about. There's all this T-cell immunity that's really hard to capture in lab tests. And so, antibodies don't give you a complete picture. And so we shouldn't test for antibodies after the vaccine to see if you're immune or not. That's not helpful either. If I don't have a reaction, does that mean the vaccine isn't working? No. So the good news is for those people whose arms are not as sore and who do not feel sick, which is actually the vast majority, more than half of the people that get the vaccine, even second dose, don't have any real symptoms afterwards. They might have, the worst of it, a lot of people are saying sore arm, whatever. They in the study did just fine. They had the same response and they didn't get COVID either. So you can consider yourself extra lucky in 2021 if you get both doses of the vaccine and have no side effects. And if you have both doses of the vaccine and you do have side effects, you get to consider yourself extra special immunity wise. That's how I think about it. I don't know if that's really meaningful. I'm just trying to put a positive spin on it, but no, you don't need to worry if you don't have symptoms, you'll be fine. And I want to make a good point here that the 95% efficacy does not mean that 95% of people will be completely protected and the other 5% are just out of luck. What it means is that 5% of people did get COVID anyway. Now, your immune system is not revved up to protect you from an onslaught of someone covering you in COVID after you had these vaccines. So the people who failed might have had just overwhelming exposures to COVID. The good news is that the people who failed did not have serious illness. So that immunity still counts. So it's still additive. Even if you're in that 5%, it doesn't matter if you end up getting COVID later. You will have a milder case of COVID than you would have had without the vaccine. That's been shown in all of the trials, and that's great news. Severe food allergies, yes, it's okay to receive the vaccine. I have severe food allergies. I got my vaccine. I did fine. That has not been related at all with any of that. There's no correlation between, now that we have more people that have had anaphylaxis, we know that food allergies are not correlated. If you have a reaction when you're there, then they treat you the same way that you have a reaction. If you've ever had a reaction, they should have EpiPens, Benadryl, and steroids available and transfer to an emergency room for additional care. If I have severe food allergies, you know exactly what I'm talking about. I hate Epi. It hurts so much. And so half the reason to avoid the foods you're allergic to is because you don't like Epi. It's so awful. Especially the older you get, the worse it is. What precautions are taken for severe allergic reactions, and EpiPens have to be available? Yes, that's required. Food allergies, more question about food allergies. It's a good question, right? Not an option for teacher. Yes, you can just say you signing up with the Lake County Health, just say other and then explain teacher. That was added later. Probably just didn't make it into their drop down. One of these days, one of you is going to log on and it'll say teacher there because somebody got around to updating the website. What's the difference between the two vaccines? There is not a big difference. In fact, the two companies, BioNTech and Moderna, used to be one company. And then they split because they had an argument. You can read all about it on Wikipedia. I have no idea if it's true, but it's very, whatever. Anyway, the point being, the argument anyway, it's true that they were one company, just the argument. So they actually use a lot the same protocols to make these types of things. They're actually very, very similar, but they are not interchangeable. So if you get one, you have to get the second one of that. And Pfizer is a 21-day with a minimum of 17-day interval, and the Moderna is a 28-day. Now, in terms of side effect profiles, if you had your choice, I wouldn't know what to tell you to do. Because the Pfizer had a few more people with fever, but the Moderna had a few more people with nausea. The Pfizer had a few more people with headaches, but there were a few more people with lymphadenopathy or big swollen lymph nodes. And the Moderna, it's 6 of one, half a dozen of the other. And there were people with the same reactions in both groups. So I don't know what to tell you. And there's no difference in the allergens. They actually have the same carrier molecules. They basically did it the same way because they came from the same place. Flu vaccine does not play a role, although we do recommend that you wait 14 days between any other vaccine and getting one of these vaccines. So if you just got your flu vaccine, you're late, but that's okay because there isn't any flu around right now. So you just have to wait 14 days before you get your next vaccine, and don't get another vaccine in the interim because that might make you delay the other one, the second dose, but just, save this time for your COVID vaccine and then resume your other vaccination practices. So do I have to wait to get the COVID vaccine after getting the shingles, flu, or pneumonia? No, you don't. You can get those afterwards. You just have to wait 2 weeks after your second dose. And that is also the time when your immunity kicks in. I think you saw in those, this was a question from earlier. 2 weeks after your second dose is when most people hit their maximal, everybody's sort of immune at that point. So you get a little immunity from your first dose, but it's not very reliable, won't stick around if you don't bother with the second dose. So you got to get that second dose. And then 2 weeks after that is when we consider you to be as good as you're going to get. Okay, so here's a long question about the Trump and Biden administration saying they want to release all the vaccine available now to be administered. And what if there's not enough vaccine availability for the second dose for people within the recommended time range? Will they need to go through a 2-shot regimen again in the future? And how much immunity do you get from 1 shot? So back to what I was saying. Now, right now, the federal government is holding back everybody's second dose, which means they're having to keep track of who's getting what when. That's ridiculous. That's something that can be done by the states, by the clinics, by the local areas where you get your vaccine. Our plan is to hold back our own second doses because we want to make sure we have them for people. And we have appropriate cold storage at University of Chicago. And many other places are getting Moderna because it doesn't require deep cold storage. So, and the city and the state have the facilities that they need to be able to hold back those doses themselves. And doing it locally means that we could get much more reliable shipments. So one of the problems with getting people scheduled is we don't know how much vaccine we're going to get next week. The federal government doesn't tell anyone. You just get a shipping notice, like literally the same as when you get something like a text message from like FedEx saying that you're going to have a package delivered on Monday. That is literally how we find out what vaccine we're getting. And by the size of the shipment, we can tell how many boxes are in there, and that's how many doses we'll have, and that's how many people we schedule for vaccine. Now, if we had all the vaccine at our local level where we could distribute it, like the state could distribute it however they wanted, bottom line, Illinois is doing a lot better job at managing all of this COVID stuff than the federal government is. And so I think it's a good idea for them to get that vaccine out there. Everybody wants people to get their second dose. There are some people arguing we should just do one and wait, but there's really good reasons not to do that. And it's okay to wait for a little while because the data from the trials does show some people who had to wait. And so it is okay to wait for a little while, but we don't want to push that too long. So it's best to wait at least the minimum number of days. And then the reason to get vaccinated as soon as possible in that window is so that you're immune faster, not because we think it's going to wear off or it's not going to work. You can boost this immunity up to probably 6 months later. But we don't know whether or not people will have to do a 2-shot regimen again, but I doubt it. I think a little bit of data analysis will help us to understand a little bit more data analysis. And it looks what I've seen looks very promising for sort of up to 3 or 4 months. So I think it'll be all right, but that is still iffy. So I think you should try and get your second dose, and Illinois is committed to getting people second doses. So remember, just because they release it from the federal supply doesn't mean that other people aren't going to be responsible with it. And then we'll know how much we have every day, and then we can schedule people instead of being like, hey, we got more vaccine, can you come get it? Like, it's real weird. It's not how it should work. Okay. Someone else in the group has rheumatoid arthritis. I am with you. I have some of the same things that you do, and I am not nervous about this vaccine at all. I was in the beginning because I didn't really understand. I mean, I understood how DNA and RNA worked, but I had some concerns about how it was going to work with our cells' machinery, and I didn't really know everything I needed to know. Once I learned more about this being used in other patients with cancer and other severe medical problems without having a lot of effects, it went just fine. In fact, I think you're probably at risk. Those of you who have immunocompromising conditions are at risk for having a lower immune response, and you should get vaccinated as soon as possible. I actually think at some point they may recommend a 3rd dose for some people who are immunocompromised, but that's way out. Maybe that's for next year. This vaccine should be safe for teenagers and children, but we don't have any data yet. So there's no reason to think that there's no long-term effect, but they didn't study it in children because nothing is studied in children until it's studied well and truly good in adults. Now, they have started doing some trials with children as young as 12 with some of the vaccines. And so we will get more data, and they are starting doses. They are starting some trials with even younger children. So just sit tight. Kids are going to have their chance to get vaccines too, and I expect it's going to be very, very safe. I don't think it's going to be any problems. Again, the fact that it's just pieces of messenger RNA that your body makes billions of every single day, and they degrade within less than an hour after you get the shot. It's hard to imagine how we're going to see long-term bad effects from that. You don't need to get the vaccine if you've recently had COVID. In fact, you should wait 90 days at least. That's my recommendation. That's the CDC's recommendation. I do recommend this for people with RA. Your doctor, I think someone else, another RA person, their doctor recommended to take it, but it could cause a temporary flare-up. Yeah, I fully expect for my joints to feel pretty awful. I'm going to just take a Mobic, which is my usual first attempt at managing a flare right before I get my 2nd dose, and hopefully that'll hold it off. But we haven't seen that in the other people, by the way, in the thousands of people that have gotten 2nd doses in at University of Chicago and across the country. We have not seen flare-ups of lupus or RA or other inflammatory diseases. So I think it's likely to be just fine. No problem with allergy to budesonide. Nope. Vaccine connected to aborted cells. I don't know that it is. But I don't think so. It does not appear to use any cellular processes to grow anything, so I can't imagine how it would be. What I'm not sure about is whether or not any research for messenger RNA vaccines in general was ever done using aborted cells. So if that's a concern for you, I'm sorry, I don't have the answer, but this particular vaccine does not include any fetal tissue or anything grown in cell culture. That's one of the benefits and why it could go so quickly. A lot of people, you're hearing about people that had increased heart rate and tingling after the vaccine. Yes, a lot of people have this. We're not sure if it's because they're anxious, because classic symptoms of anxiety are that your heart races and then you breathe faster, and that actually makes your calcium go down and makes you have tingling in your fingers and your lips. And that's a really common anxiety reaction, but it's happening so frequently that I'm not sure it's just anxiety. It seems to go away pretty quickly. We're seeing it all the time, but no one's having any serious effects. We've tried sending a few of those people over to the emergency room, but by the time they get there, and I'm literally meaning like we're wheeling them across 2 buildings, they're fine. So I think I wouldn't worry about it. That seems to be very transient and seems to be related. Maybe it's the lipid, maybe it's the polyethylene glycol. I don't know, maybe it's the shot. Some people have reactions to just having an injection. Nobody knows, but it seems to be more of not so much a direct effect of an ingredient in the vaccine as it is a sort of physiologic sort of reflexy response to the presence of that in the arm, not because it's going throughout your body and causing tingling in your fingertips. Side effects for thyroid patients? No, nothing in particular. Same as everybody else, we've had a lot of thyroid patients get vaccinated already, and because there are a lot of thyroid patients in the world, most common endocrine diagnosis after diabetes. How long should you wait after having COVID? 90 days, I'll say it again. Do I know which vaccine Illinois will be getting? So we have Pfizer at University of Chicago because we're a research institution. We literally have rooms called freezer farms full of these -80 freezers where you can rent space to hold on all of your stuff. I have a -80 freezer in my infection control lab. -80 freezers are they're like mini microwaves in a giant research institution. That's not exactly true. They still need a lot of stuff around them. But the point being, we have a bunch of them. We have lots of storage space. And so we're getting allocated a lot of Pfizer. Most of the places that are sort of pop-up clinics and things like that are getting mostly the Moderna because it doesn't require as many low degree freezers to keep it. It can be out a little longer. You know, the issue with this and why it can't just be available at your doctor's office is because it comes in multi-dose vials. There's 5 to 6 doses in each vial. And once you thaw it out, you have to use it. You have to dilute it, and then you have to use it within like 30 minutes. And so you can't just like say, you know, whichever patients that come to my clinic today, I'll just give them a vaccine. That doesn't work. So you have to have people lined up, ready to go and on it, and sort of crank through them. And that's just not something that regular clinics could do. Plus you need you'll see what it looks like when you go and get your vaccine. There's one person doing one job, one person doing the next job. It's more like an assembly line because everything has to be done quickly in the same way than it is when you go to your doctor and you ask for a flu shot and they go to the fridge and they pull out a little cartridge that's preloaded and the nurse just attaches the needle to it and wipes off your arm and pushes it in. Right? It's not like that. There's all this things, and they're delivering the vials and they're delivering the syringes and then they're drawing it up and they're trying to get 6 doses out of every vial, and it's just a different way of doing things. So you will get one or the other based on whatever they have wherever you go, and they're both great. Don't worry about it. 65 and over is 1B. Those with health risks are included in 1C. So you have to be an essential worker or you have to be 65 and over in order to be included in 1B. What's the time frame of availability and having enough vaccine? So we currently have more vaccine than we've used. Now, there's not going to be enough vaccine, but the manufacturers, as soon as we can get stuff out of their deep freeze storage places, can make more, which is another good reason to get those doses out to other people across the country and to states where they can use them. We really need, because of the difficulty in administering this vaccine and managing it and getting these sort of fast track lines done in order to get people vaccinated, boom, 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 in a vaccine clinic. It's been hard for us to get enough people vaccinated. We've been really successful at University of Chicago. We've vaccinated 20% of the people in Chicago who've gotten vaccine at our hospital because we've been extremely sort of just effective and efficient about it. But it's been really hard for other people to set up these things. I mean, there aren't a lot of people working in public health who are qualified to give shots and manage for anaphylaxis and that sort of thing. So this is harder to do. And I think that is what is limiting getting the vaccine out. But it's going to take time, but there's more and more vaccine coming every week. So just keep looking. And it doesn't matter if you get vaccinated this week or next week or the week after that. It matters if you get vaccinated now instead of March. So just get your vaccine as soon as you can so that the next people up are able to get, if you're one of those people who is not so hesitant and I don't think anybody should be hesitant, just get your vaccine as soon as you can get it so that you're out of the line and the next person in line can get the next dose. That's, it's like the drinking fountain. When you tell the kids they have to count to 3 and move on, it's that. Get through the line. I got Pfizer because that's what we have. Somebody who asked, are there issues of flare-ups or more intense side effects? No, I said for people who have autoimmune conditions, we haven't seen that. If a teacher is vaccinated and their students or parents are not, are we completely protected? You're not completely protected ever. But this is a huge, huge layer of peace of mind that you should have. Now, no one, schools and hospitals, these are not COVID-free environments. We're trying to make them COVID transmission-free environments. That's the goal here. And so having all the teachers vaccinated is really important. It's going to help you to avoid having issues with your break rooms and where you're eating lunches and when you're having your coffee, you know, outside away from other people, because there's unmasked times. And when the kids are eating their lunches, you know, they are often having asymptomatic cases. Now, there's not a lot of transmission to teachers as it is. Teaching, it looks like schools are not a hotbed of transmission, but we don't want them to be, and we want to be able to pull more people back into schools. And so these places that sort of don't have as great ventilation, or don't have as big of classrooms, or don't have as many people to supervise and need to have bigger pods than 10 to 12 kids, you know, that's, the vaccine helps to make a stronger layer so that you can lighten up on those other layers. But it really takes everyone to be involved. So everybody's got to get out there and get vaccinated. Enlarged T cells due to leukemia, yes, we recommend that you get vaccinated as early as possible. You may not have the same response that others do because your immune system isn't quite normal, but it's all the more important, because your immune system isn't quite as normal as other people's are, for you to get vaccinated. And those around you also need to get vaccinated as soon as it's their turn. I think that you guys, I'm being asked about the timing for vaccine. I think you're going to be offered vaccine sooner than you expect to. I don't think it's going to be mid-February. I think it's going to be January. I think it's going to be soon. And I think 90 days is my answer for all the people that have told me they have had COVID and would like to know when to get the vaccine. If you've had both doses and you come in close contact with someone who has positive to COVID, do you still have to quarantine? So that is a decision that the state and the city have not made yet. We are actually relaxing that at the University of Chicago. We're going to start allowing people who have gotten both doses 2 weeks after their second dose. They are going to, we're reducing their likelihood of needing to quarantine after an exposure. The risk stratification in healthcare is a lot more complicated about PPE and all these other things and what was happening with the patient and that sort of thing. We're reducing them by 2 levels, which means they basically won't have to stay home, but many of them will still get tested. This is where we'll get a lot of information about whether or not people are catching COVID, subclinical COVID, after they've been vaccinated. And so that'll be really helpful in making that decision for other people. I would expect that for a while, at least, they'll still recommend that you stay home and be quarantined, but that quarantine is a lot shorter now. You can test out at about day 8 and it's day 7, and hopefully that won't necessarily be the case going forward. That's kind of cool. My
This
son's
is the final one.
showing me his
I
project
have to get it ready to cut.
for humanities.
It's ready.
The number of people who have died after getting the vaccine is lower in the vaccine groups than it is in the placebo groups. And it is not different than the average death rate in society for people that don't have COVID. I don't know when children under 16 would be able to get the vaccine. I'm hoping as soon as possible, obviously, but I think that we need to get through all the other people. They are really pretty low risk for having bad outcomes from their infection because they have fewer probably because they have fewer ACE receptors than adults do. So I think that they will definitely be at the tail end of this vaccine. And so hopefully the trials will be done by the time we get to them. If you're recovering from shingles, no, it is not an issue. As long as you are not acutely ill with a febrile illness that is sick enough to keep you home from work, you can get the vaccine. Now, if you think you might have COVID, or if you have any symptoms of COVID, you should get tested for COVID before you get the vaccine. Because if you're positive, you don't want to double up on the vaccine and you don't need the dose right then. So make sure you get tested, but as long as you're feeling well enough to get the vaccine, same as flu, even if you have a sniffle, as long as it's just a cold and not COVID, you can go ahead and get the vaccine. And if you're recovering from something like shingles or an RA flare or any of those things, I was in the middle of an RA flare when I got my first dose of vaccine and I was fine. It was really tough end of December for me. All right. After the second, it was like a very fitting end to 2020. I was like, Jesus. Okay. After the second COVID vaccine, is it safe to go back to your normal activities and be around people that have not been vaccinated? Yes, but you do need to wear your mask, keep your distance, keep the ventilation up. You don't want to just go back to normal life. You need to keep those other layers of protection in place because you could get an overwhelming dose from being up close with someone with bad COVID. We do not want anyone to do that. People are still wearing masks when they care for patients and all of those sorts of things. The vaccine is supposed to protect you from sort of a regular exposure. It's not been, it was tested in a mask wearing high prevalence situation. International travel in the vaccine process, hopefully as soon as possible. I can't wait to travel again. I'm really sick of being grounded, basically. But I think it depends on where you're going, why you're going, and what the reason is. I think that is, up in the air. Still a lot of those questions I don't have a good answer to, but I'm waiting like you are for feeling comfortable traveling. If you live in the city, can you sign up and get vaccinated in another county you work in? Yes, you can. Depending on the rules in that county, just sign up everywhere that you possibly can. And to get into this first one, just remember to cancel the others. Oh my gosh, there's still like, okay, I'm getting near the end of this list. I have to answer these questions. I only have 10 minutes because then I have to go tape for Chicago tonight on WTTW tonight. So we're gonna go fast and get this done. Am I concerned about, the doctor that died in Florida after receiving it? No, I don't think so. A lot of people have strokes. It's even young people who are healthy can have strokes for a number of reasons. There was never any issue with strokes in the vaccine group. We haven't seen it in anybody else. One person does not seem like it is likely to be related to the vaccine. Think about how many people have strokes on a daily basis that didn't get the vaccine, and then how many people got the vaccine and how many of them had a stroke. The numbers, the percentages there are probably about the same, maybe lower in the vaccinated group. Taking vitamin D. Yeah, vitamin D is, there's growing evidence that vitamin D does help prevent bad outcomes from COVID. And I take vitamin D every day for that reason. And I give it to my child and I sent it to my mother. Now, is it slam dunk? No. Should you take way more than the recommended daily allowance? No. Talk to your doctor if you have any problems with your kidneys or if you have had, if you're wanting to take a super high dose, but 2,000 daily units, international daily units should be fine. If we didn't select essential worker when we first signed up, now that teachers are an essential worker, I don't know about that. I don't know. Lori's shaking her head. So I don't know about if you need to be concerned about if you didn't select essential worker.
You do not need to be concerned. As long as you've signed up in the portal, whether you live or work in Lake County, once we get our date for Stevenson, they will work through all those details. Lake County Health Department said you just have to be signed up in the portal. Don't worry or stress about that. Just sign up.
Okay, good. I'm glad you have an answer for that. I don't know. We don't have that. We use something different. After getting the vaccine, what's the procedure for watching to make sure there's a reaction? Everyone stays for 15 minutes. People who have severe allergy history of severe allergy to anything, including a food, stay for 30. That's it. You wait there. You're watched by a nurse. There are crash carts and all the things you need. Okay, yeah. Yes, you will probably get a card that shows you've been vaccinated. It's mine is like a flimsy piece of copied paper that just says my first vaccine date and then when I go back on Saturday, they'll put in my second date. And you want to hang on to that and keep it because while I'm not necessarily a fan of immunization passports being necessary for activities, that doesn't mean that's not going to happen. So you want to hang on to that. I'm going to laminate mine and take a picture of it and put it in my phone so I have it everywhere. I don't want to be kept away from doing anything. Any risk for elderly people with high blood pressure, diabetes, kidney issues? No. In fact, they vaccinated a lot of high-risk individuals in the original trials, and they did great. And now and we've done a lot of nursing home residents, and they've all been great. They actually have fewer reactions than people who are younger. Their immune systems aren't as strong, and so they won't have as bad. They actually didn't have as bad of reactions in the studies. I can't answer your question right now, Alex. Is there a way to test for an allergy to the two materials? No. If you have a problem, talk to your allergist, talk to your primary care doc if you think you might be allergic. But if you've ever taken Miralax or had a prep for a colonoscopy, you're good to go. And polysorbate is in a lot of your beauty products. So if you go and read the labels of a lot of the things that you put on your hair, your lotions, polysorbate's in a lot of those, in bath bombs and that sort of thing. And so if you don't have any problems with things that list polysorbate, you should feel pretty confident about that. I don't know how you'll be notified when it's your turn. That's a good question for Lori. I'm going to skip it for now. Okay. She's answering. We'll be vaccinated at Stevenson as long as you've signed up in the portal. We'll share the date. Oh, yeah. See, she already answered it. She's way ahead of me. Wait 90 days. What if you had it, but you were asymptomatic, so you didn't know you had it? There is no harm in getting vaccinated, even though you may have had subclinical or unknown COVID. A lot of people in this study, not a lot, but some of the people in the study actually fell into that category. They found out they had their antibodies drawn the same day they got their first dose. And so we know from that they did just fine. And they seem to have maybe slightly more arm soreness and maybe more symptoms, but they weren't sick or in extremis or anything like that. And that's not associated with any of the allergic reactions. Can you get vaccinated during the period between the first and second shingle vaccine shots? Yes, you can delay your second Shingrix if you need to in order to do this. That would be fine. How long will you test positive after COVID and symptom-free? It depends on what kind of test you use. If you use a very high sensitivity PCR test, you could test positive for 150 days or more. Those are not, that's not super helpful to use to tell whether or not people are negative. So we don't recommend testing at the end of symptoms. Once your symptoms are gone and 10 days have passed, as long as you weren't hospitalized. If you're in the hospital, then you want to go 20 days, or if you're seriously immunocompromised, not even RA, but like you just had a stem cell transplant, then we want to say 20 days. Oh, lots of thank yous. That's very, very kind of you. Would I get a question about if I was pregnant and I was in my 3rd trimester, would I wait it out or would I get the vaccine now? I get the vaccine now. Because the only thing that's, your baby's cooked. The most important thing now is to avoid having preterm delivery, and that's the one thing that COVID causes most frequently. I get the vaccine. Is there a concern for people registering as teachers when they're not and exhausting the supply? There's concern about everything like that. I'm sure that those who are managing teacher vaccinations are going to have some sort of plan in place, although I don't know what it is. And we're still figuring out how we're going to verify these things for people that come to us. You know, you guys have a system set up at Stevenson, right? But a lot of places don't. And we're still working now with getting a lot of external healthcare workers and how are we going to verify that they work where they are and how much of that's our responsibility. It's all happening in real time and we're figuring it out as we go along. A couple of people getting a vaccine that don't deserve it should not stop us from vaccinating as many teachers as we can. But if it's a huge problem, then that's different. Oh, there's just a lot of thank yous and not so many more questions. I think I got everything. Is there anything left? Any other questions that anyone has?
I thank you so much for your time. You answered so many questions. Really, you see the thank yous. You're being flooded with them, so we can
That's
give you
very nice. Yeah.
We really, really appreciate your time and your expertise. Again, we thank you so much.
Oh no, thank you guys. You guys are too kind out there. This is you're very, very welcome. Okay, now just go get vaccinated. And then the most important thing, tell all your friends how it was worth it. Be prepared for having bad side effects, and if you don't get them, be grateful. And if you do, take some Tylenol or some ibuprofen and just grin and bear it. And then tell everybody that it was worth it and you want them to get vaccinated too. There's a lot of people out there who are really worried. And they're worried for a lot of reasons. This has been such a messy pandemic, right? With all the politicization and who's right and who's telling the truth and who's not telling the truth. I'm giving you what I think is what I know to be honestly the truth. And I've been honest when I didn't know and when we didn't have information about it. So I hope that you hear that and that you can tell other people about your experience, because we're finding that what people want most is not to hear all the data and see the graphs that I showed you. They want to talk to somebody who got a shot and did okay. And that's what you're going to be, because you're in this early group. So use that to help encourage other people, because the more we can get people vaccinated, the sooner we can get back to normal. But the better thing is the fewer people we're going to lose to COVID. It's already a huge tragedy. So thanks, everyone. Positive note. See you later.